talk about one drug that's removal and FDA approval. Uh, my topic is about oxymetazoline 0.1% in acquired blepharoptosis. My top presentations are composed of four parts. The first one is introduction, and then the method, results, and conclusion. The first one we want to talk about the blepharoptosis is an abnormal dropping of the upper eyelid margins with the eye in the primary gaze, and if it's severe, it can lead to be a superior linear view deficit. We can measure the distance between the upper eyelid margin and light reflect. We call that MRD, and normally it's 4 to 4.5 millimeter. According to MRD1, we can divide ptosis into three. The first one is mild with MRD1 3 to 4 millimeter, and moderate ptosis is 2 to 3 millimeter, and if it's less than 2 millimeter, it's severe ptosis. And we have to know the reflective elevator functions. With the normal is more than 15 millimeter, and the poor is less than 4 millimeter. The classifications of ptosis have three things. The first one is congenital, the acquired, and the pseudoptosis. And today my topic is focused on abnormality in acquired ptosis. In this abnormal acquired, the standard of care is surgery, but we need to face with the asymmetry or over or under corrections, or bleeding, or maybe lymphoma or infection. So the question is, should we do the other things, non-invasive or an effective treatment, for example, the drug? And the question is yes, we have the oxymetazoline. The first one, the mechanism of this drug is just an alpha-adrenaline receptor agonist, and this targets in the neural muscle both alpha-1 and alpha-2 receptor. Before this thing, oxymetazoline is used in topical nasal decongestion, and used in topical eyes for vasoconstriction, and diminues the blood. And now the Utni is a drug of oxymetazoline, which is FDA approval in United States in 2020, and it treats acquired ptosis in adults. And the cost of this is about $300 for 30 days supply. The question we need to pay attention. The first one, does the medications have a ptosis, positive effect on ptosis? And the second thing is the medication safe for the patients with ptosis. So we have the clinical trial, and I want to talk about two clinical trials. The first one is about the safety and effectiveness of this drug, and the second one is about the onset and the durations of this drug. The first one, for the safety and effectiveness of this drug, we can see here more than both of these clinical trials have the same method about the subjects. They have two clinical trials, and the first one is LVA 20 and 200 year old, and they have they have more than 200 patients of oxymetazoline, and about 100 patients use placebo. These clinical trials randomized 2.1 and double mask placebo control. And the first one, in the first clinical, you can see here the MRT one in the day one is about roughly 1 millimeter, and after 2 hours, supply this drug, and in the day 20, in the day 14 is about 1.16 millimeter. You can see here the patients after use this drug. The first picture about the woman. A is a baseline, and after 2 hours of installing this drug, you can see the elevator of the upper eyelid, and the same with this woman. And if we talk about the safety of this drug, the first I need to outline this is no serious adverse were suspect to be being treatment related with this drug, and in topical, we can see here the punctate keratitis, the visual blurred, and conjunctival hyperemia, and maybe a little pain. But the question we should think about is this drug is targeted on anti-adrenergic, so should we use this in angle glaucoma? Some clinical trial measure the pupil, and they see that no dilations with the pupil, so we can use this in angle glaucoma. And if you can see that this drug is safety and effective in the ptosis, so the question we should pay attention is what is the onset of this action, and the second thing is how long does this effect of this medication last. The inclusion of this study will be the MRD one is less than 2 millimeter, so it targets on the patients with moderate to severe ptosis, and it needs to be lost on the reliable peripheral visual field of 8 points in the top 2 rounds. Exclusion of this study is every cause of the ptosis. For example, congenital ptosis, pseudoptosis, oral marker guns, and previous ptosis surgery, which is less than 3 months. The primary outcome measure here, we can see the MRT one. The first one is pre-installation, 2 and 6 hours after installations, and the other one is 5 minutes and 15 minutes. You can see here the main change for baseline 5 and 15 minutes. The day 1 and day 14 is about roughly 0.6 millimeter, and the day 42 is about roughly 0.9 millimeter. And we need to pay attention this effect will also immediately post-installations on the day 22, and the proportions of the subjects was more than 50% greater in oximetry, with the largest difference observed in 2 and 6 hour post-installation. So my conclusions after 2 clinical trials, the first one, the oximetry 0.1% is an effective non-surgical for acquired ptosis, and no serious adverse was suspected, and oximetry will provide rapid and substantial upper eyelid elevation. Thank you for listening.
Okay, thank you very much for the presentation. Yes, so any question or comment? But how about your idea?
in say your English skill perfect. You speak English fluently and with a good pronunciation and everything. I read also your article on the internet, and we just wonder about how about the duration effect of cytomegaloid. It can run the duration of the effect for how long?
The clinical now is about 24 days,
24
and
days.
they just measured in 24 days. In the US, they usually use it for, in the adult, they use it every day, and this is so long, but they just count in 24 days. It's about 6 weeks. But after 6 weeks, the patient still uses, and the effect of this still maintained.
I learned that makes bigger feel whiter.
Yes, is
how about the cosmetic reason? As you give it some images, picture, the cosmetic reason will be perfect. I think the duration normally 24 days. As you in the US 42 days.
Yes, it was 6 weeks.
You should consider well concerning with side effect or secondary effect of cytomegaloid. So with heart disease, glaucoma, and we give woman feeding baby on something.
Yes.
Warning about that.
Talk about the side effect. The first one in this in inclusion criteria, they didn't choose the patients who have uncontrolled the hypertension, and for angle glaucoma, they didn't want to choose the patients with angle glaucoma, but in some another clinical trial, they measure the pupil, so they see that this drug doesn't dilation the pupil, so they say that it can't to take the acute angle closure. But with the patients who use this drug, I think the doctor should talk the patients about the symptoms of the acute angle glaucoma.
And dry eye also. They get with dry eye condition. It may make it for a dry eye more worse. Dry eye.
Yes, the dry eyes. The dry eyes, they have another clinical trial. They used to use for this. In 1983, they used oxymetazoline, but in the lower concentrations, lower than 0.1%. But they see the dry eye, so they they think that maybe this drug can turn to be the dry eye. But in the patient, more than 300 patients in this clinical trial, they didn't see the dry eye.
Good thing for blepharospasm, different with pulse, I think, and the problem the elderly people. So good reason and very cheap medicine. Thank you.
So for blepharospasm, so the patient can see for how long, and how about the long time follow-up? And I'm afraid that maybe for this a long and for a long time, so maybe it's communication, like the glaucoma, glaucoma, and as well as other communication, for example, cataract, more improve, reduce a lot, and there's any study about percentage it reduces I got for a long time.
Excuse me, can you repeat the question? I didn't hear.
How about the other complication and follow-up this study for slow time to reduce repetition?
I think for the complication, they need to duration the time of our treatment the patient, because all the clinical trial just durations for 6 weeks. So maybe we can detect the real complication. For example, here they talk about the complication, but they think that no serious. For example, the symmetric in the patient use this drug, and some of this is contact keratitis or visual blur or conjunctival hyperemia. They just said that, but I think we should durate the time of see the patient. 6 weeks is a little bit.
I think we can follow up for a long time. Yes, for the discover and this complication further. And there's any question or comment for Dr. Well, how about Dr. Ben? Any comment for Dr. Hoa? Okay. Once again, thank you very much for your presentation.
Thank you.